So when someone goes to a site to get a collection, or if someone is collected at the ED or in the hospital, those samples will make their way to our laboratory. If it is at a site, they'll be shipped to us via courier, so in a courier car. That can take a little while, depending on when the site closes and how long it's been open and how many drops they do during the day. Once that specimen arrives in the laboratory, it is what we call received in. That means that we confirm that we've got it. It helps people to know that samples that have been collected made it to where they're supposed to be. Some of it is depending on where you get tested. The courier and the amount of time that it takes the courier to get here is going to play into turnaround time. The most important thing that really plays into turnaround time issues is registration. When they register for a COVID test, when you put your name on a label, the most important thing you can do is to use your full legal name because a lot of times somebody will put a nickname, a middle name instead of a first name, and so then when that comes into the laboratory, we have trouble finding the patient and who that test belongs to because the name wasn't correct. Once it is received in, it then is going to be aliquoted for whatever machine we place it on. Luckily at MUSC we have several different options of platforms that we can use. And we do utilize all of those platforms, especially in a surge like we've seen recently. So aliquot just means that we take the sample from the tube where it was collected and place it into a second tube that's machine specific. Platforms are instruments. So in the laboratory community, we refer to our instruments lovingly as platforms. When that specimen is received in the laboratory and is then aliquoted, it's going to be set aside for the machine that it's going to run on. We run it on the machines as quickly as possible. Our two major workhorse machines for the laboratory are random access, meaning that we can continually load them. Once loaded on the machine, the sample will have the nucleic acid extracted, meaning that the virus is separated out. Then we do a nucleic acid amplification, or a PCR assay, and that's actually going to amplify that virus if it's present in the sample. So if the virus is present in the sample, it will be detected as positive. If it is not detected in the sample, then it will be non-detected or a negative sample. Those results automatically interface with our electronic health record, and so the results are immediately released into the health record and then can be sent out via MyChart. It's all about trying to get the results out as quickly as possible. The sooner that people know whether or not they're positive, the sooner they can take countermeasures to try and keep those people around them safe. My team is amazing, but they are basically, we're here 24/7. A lot of our peak time is overnight. While many people are sleeping in bed, we are busy aliquoting or pouring off those samples and getting those results out. I know that testing can seem really frustrating right now because everybody wants to know whether or not they have COVID. But I guess for me, the most important piece of advice is if you don't feel well, isolating yourself until you know whether or not you may be sick with COVID is really the best option. And I know that's hard sometimes given our lives, and some of us don't have the luxury of being able to take that time to be careful, and so we have masks. N95s, KF94s like I have, all really good choices because they're higher grade, and so they can help control the virus spread.